Hi everyone, thanks for joining me this afternoon for this talk on health and safety. We've designed this webinar to be tailored towards small business owners and leaders of people. So if that's you, then you're in the right place. Okay, so we're going to be running through a few little bits, giving you some info on what your legal requirements are, what you need to be doing, what the basics are. We're going to be looking at some tools and some tips for you to improve your health and safety provision. And then we're also going to be looking at how you can use this as a tool for business growth as well. So I hope you find it useful. My details are going to be shared at the end as well. So please feel free to get in touch with me should you have any questions following that. So just give you a bit of an intro on myself. So my name's Tom Bradley. I'm a health and safety consultant. I work with small businesses to help them grow and improve safely. I'm lucky enough to be an associate consultant for Limelite. So I look after all the health and safety for them and for their clients. So, and it works really well, really, with working with the HR company, because essentially it's what they do and what I do. It's all about looking after people and making sure we get things right. So today's session, I touched on it briefly before. We're going to give you an outline on some key responsibilities as an employer. I'm going to give you some tools to improve. We're going to speak about staff engagement, which is quite a big contemporary issue for health and safety. And then again, we're going to, I did touch on it before. We're going to run through how you can use this not as like not as something you've just got to do, but as something you can actually use to drive your business as well. Okay, so key employer responsibilities. So the workplace is the first one. Now these all really derive from the Health and Safety at Work Act, which I'm not going to delve into and dissect with you, because I was fine as soon as I do that, everyone switches off. And I wish I didn't mention it then, but I did. But anyway, so we're going to run through these, and it derives from this. But I mean, essentially, you'll see as we're running through them, they're all things that you sort of know you should be doing anyway. Nothing's like out the blue or out the ordinary. So they're all things you're probably doing. You might be able to improve on them, and if you're not doing them, then certainly you should be getting a plan together to put in place to start delivering on these. So the workplace, first of all, and basically this is looking at the physical and well-being of the workplace in which you work in. So this is in terms of having things physically right. So if you've got people at computers, it's making sure that your DSE's right, your display screen equipment. You've got adjustable chairs, that kind of thing. If you're working with machinery, it's making sure that guarding's in place, that dust is being extracted safely, and it's just a safe environment. So in terms of the well-being that comes under this banner as well, it's really important. So over 50% of work absences are work-related, derived from stress, depression, and anxiety. Even when we do accident investigations, even if it's a physical accident, which then wouldn't come under that banner, it's normally been a contributing factor in that. That when we talk to people, so why did that happen? Why did you do that? Well, I was worrying about this, or we're under pressure because I knew I had to get this order out the door, or we knew we had to get it finished quick because such and such was starting their job, and all those kind of things. So in reality, it's probably a lot higher than that. So the next thing we talk about is equipment. And basically this is providing safe equipment. You need to supply the equipment that you expect your people to do their role with. It must be suitable. So in the initial purchase, you've got to buy something that's suitable and appropriate for it. It needs to be regularly maintained and tested. And you also need to train your staff on it. So it's not good enough that you buy the right things. You could have like the best thing ever, but if they don't know how to use that safely, that's not good enough. So practices. So this is basically providing a safe working environment as well in terms of the actions that you're doing. So this is safe systems of work. So doing risk assessments, coming up with standard procedures for how you do something. So if you want someone to unload a vehicle with a forklift, for example, you need to detail that, and tell them exactly how you expect them to do that and how that is to be done safely. There also comes into that as well, I'll just touch on it briefly, lone working. So even if maybe appropriate for many of you here, If you have people that work from home, for example, that's classed as lone working. If you've got a salesperson that's out on the road visiting clients on the road, they're classed as a lone worker. The special procedures and policies you need to have in place in order to make sure they're safe. And it's a key responsibility which comes under this section. So, and it doesn't have to be anything like really out of the ordinary. Often it's things like just have a procedure where you check in with them maybe twice a day. Their line manager or their supervisor has a 2-minute conversation with them twice a day just to make sure that they're all fine and they're okay. Okay, next we have first aid. So this is basically ensuring that you have first aid equipment available. So this needs to be, it's dependent on what you do and the level of first aid equipment you have. So you normally can buy quite a standard basic first aid box, which for an office would be absolutely fine. If you're doing something that's more hazardous, if you're like a tree surgeon, for example, you're going to need something a bit more than that. So it's in terms of making sure that's appropriate for it and having staff trained as well. So we always recommend that you have a minimum of 2 people trained at any site and any location per shift for a place of work. And the main reason for this is some people say, well, that's fine because we've got Adam and he's our first aider. Well, that's fine unless Adam has an accident, and then there's no one that can attend to him. So you sort of on a minimum of 2, depends on what you're doing. And it depends on how sparse your workplace is. So, for example, if you were on a site and different place are miles away, you either want something in a vehicle or you need some at each location. It needs to be reasonable and suitable, and it's just common sense really when you think about that. Okay, so information, training and instruction supervision. So you have to provide information, training, instruction, supervision for your staff. This is something you need to do. If you were expecting them to do a role for you, you need to let them know how to do it and support them along the way. So the supervision comes under it as well. So that basically if they're not doing it the right way, you either need to give them more guidance, more training, or maybe you need to put them in a different role that they're better suited to. Consultation. So this basically comes down to engaging with your workforce really. So you have a legal requirement to engage with your workforce on issues such as safety. So you must do this. So any matters that are involved in your health and safety policy, you must involve your staff with these issues. So this may be creating a health and safety committee. For a smaller business, it might be just appointing one person. Or for others, it can be something as simple as just inviting every time you have a meeting. So we've got a client and they have a meeting every month where they invite everyone into the business. Everyone in the business is involved in this meeting. They come to it, and I said to them, "What a perfect opportunity!" They really look at targets and strategies and what's the next marketing thing. I was like, just put a topic in there for health and safety, and get them just to get involved and give some ideas to it and some feedback and that kind of thing. So that's really important. And also just feeling that your staff are being approachable to your staff so that they feel they can come and talk to you. A lot of people, if they're fearful of their jobs, for example, if they raise an issue or they feel that they're like, maybe grassing someone up and they're going to get in trouble and they might lose their job, that can really be a barrier to the communication. So what we want to see is they feel that they're safe and comfortable. They can come talk to you about something and you're going to deal it and handle it in an appropriate way. Okay, so health and safety policy. So for 5 people and over, it's a legal requirement. You must have a written health and safety policy. For 4 and under, you don't legally have to have one written down, but you should still have one. So, for example, if you had an accident and HSE came and investigated it, and you're just a 2-man band, they could come to you and be like, "What's your approach for health and safety? What's your policy? What are you doing?" Especially if it's following an accident or something, I would certainly rather have it written down so I can refer to it than try to go off the cuff and reminisce about what I thought it was 2 years ago when I had that thought. It makes sense just to have it written down. One thing I'd also do is just make sure if you're going to write it down, make sure you do it. we get sent so many policies for review from people, and you look at them and I'm like, this is brilliant, it's fantastic, can't do anything, can't give you any improvements on it, it's absolutely brilliant. I was like, do you do all these things? Oh no, that was just one we found on the internet and we downloaded it and I signed the bottom and every year update it. It's pointless, don't do it. If you're going to do a policy, make sure that it's true, it's accurate, and that it is things that you actually implement. Don't ever put anything in your policy that you've got no intention of doing. So reporting, so this basically involves reporting of accidents and incidents, so it's keeping an accident book or an online equivalent, just basically keeping a record of that. So it's a very good tool in terms of analysing what's happened, and in terms of like moving forward with things, it's a good place to start, because that is where things have failed. When you have an accident, that is when things have failed, and something needs addressing straight away. So when I go into a company to do any audit or inspection, I'll always ask to see the accident book, because that'll give me an indication of what's happened in the past, and I can talk to them, see what control measures they've put in place to reduce that risk in the future. And it's a real good key to do that. It allows you statistically to monitor it as well. So if you can see that you're having a rise in accidents over a steady period, you need to take some action and do that. Likewise, if you can see that your accidents are reducing, the likelihood is the things that you've put in place are working. So continue to work with them, continue to develop them, continue to go with them. And then we've got RIDDOR, which is basically a reportable accident. So, and this is when you must report an accident to the HSE. So we can give you a full detail of that. I'm not going to go into that because that is quite a big subject in itself. If you want any more information on that in particular, or you're ever in doubt, you can go on the HSE website and have a look at the criteria. I can also talk you through it. It basically refers to a significant time off work, broken bone or other injury, but the exact criteria is detailed on there. So in a poster, so it seems a bit weird in today's day and age, and especially when we're working remotely, but you should have a health and safety poster which dictates the employer's responsibilities and also provides the details of who's responsible for health and safety. So if you needed to approach someone, you can go to that poster and see that. We could have a virtual poster, that kind of thing, if everyone's working remote and working from home. So you might have one up in your head office, then you might have that available, on your online employee portal, or similar for that. Okay, so we're going to look at some tools to improve, which is probably why a lot of you have come here today, is to try and get some tips on how to improve your safety provision. So I'm not being rude here, but you are, as a business owner or a leader of people, you are the biggest tool available to benefit this. And it really comes down to it. It's basic stuff, really. It's leading by example. It's taking it seriously. It's demonstrating your commitment. It's adhering to the systems. If you go into a warehouse, for example, and you're the business leader, if you're not adhering to those rules, what message does that send to the staff that are there? That those rules are you're too important for them. They don't apply to you. You can just do what you want. Why can't they? And it's simple things like use designated walkways. I've used this picture here to depict they put their PPE on, they're wearing their glasses and their hard hats, that kind of thing. Really just demonstrate that commitment to it and that it is serious. Allocate resources. So this is one thing we get quite a bit, where people often talk to us, and we chat to people and business owners like, health and safety is really important to me. Looking after the staff and the visitors to the site, there's nothing more important to me. It's like, okay, well let's do this and let's do X, Y, and Z. How much is that going to cost? Oh, this much. Oh, I don't pay for any of it. I don't mind signing off on a marketing budget, but there's no way I'm going to put some money towards that. Well, it's a clear indicator that you don't take it seriously, and you just pay me lip service, and you're not really dedicated to it. Part of the resource, part of it's financial. It's also freeing people time up for it. So often we'll put plans and processes into place. It takes a bit of time. Even if it doesn't take money, it might be a bit of that person's time in a day, maybe half a day a week, that they need to put to one side to start improving things and developing practices and procedures. And they often don't want to let their employees do that and it's, yeah, it just doesn't then work. So definitely do that. If you're serious about it, you want to improve it, get used to, you're going to have to allocate some resources towards that. So, and believe in the process as well. So, you know, like you say, when people just come, you can tell them they're paying you lip service and it's just something they want to do. I mean, you get it with safety, you get it with people with environmental issues, you know, where they sort of, you know, they might want to, like, you know, have a big spiel about it on LinkedIn or, you know, in public and that kind of thing. And they don't really believe in it or take it seriously. So, you know, if you do come on board with it, you know, you can book a session with me, you know, like this one by the end of it will do. You can book a session with me. I can certainly, you know, I can give you some messages and that kind of thing that you can relate to people, that will get them, you know, brought on board with it and help them believe in that process. Okay, risk assessment. So this is the next tool. So it's one of those things. I really didn't want to put anything like this in here, but you sort of, I was thinking about it, you sort of can't really not. So if you want to improve your health and safety, basically the core of it and where it all starts is with a risk assessment, really. So it's looking at hazard identifications within your place of work. So it's quite a lot of people will look at this in the physical sense. As we've touched on it, you know, there's also like stress, mental health, they're all hazards. You know, you need to be factoring in these things. You know, if you've got someone working at home, on their own all the time and no social interaction, you know, what is that doing to that person? You know, are they going to be happy? Are they going to be, you know, are they going to be feeling safe in their work? Are they going to be productive? And the chances are they're probably not. So there's the physical side of it as well, where you might look at, you know, slips, trips and falls, or a crushing incident with a motor vehicle, that kind of thing. They're all important too. You really need to be looking at everything. So, and the way I always like to do this is doing it task based. So if you look at a task that you're expecting your employees to do, if you can then you break that down into a safe system of work or method statement, look at the hazards along the way. So we're going to look at an example shortly in this as well, but we're just going to talk through immediately about the process of it. So there's 5 steps to it. The first one is you identify the hazard. So what is it? And you want to be quite specific with this as well. So not just like someone might get hurt, it's how they're going to hurt. Their broken leg, you know. How are they? Someone might be off work with stress. Well, what's going to happen? Well, they got so anxious about work, you know, the levels of anxiety, you know, that kind of thing. Be quite specific with it because that is really helpful. The vaguer you are with it, the less effective it is. So identify who might be harmed. So this is the actual physical person it is. So in terms of, you know, it could be like a delivery driver or the forklift driver or the person who's working from home on, you know, a dining room table chair, and they're going to get a bad back and a musculoskeletal injury from that. So what are we already doing? So this is what is already in place. And people often sort of skirt through this a bit, but there's often things people are doing to mitigate these hazards anyway, you know, and sometimes we do it without thinking about it. And it's not until you really get down to the crux of it and break it down, you realize actually, maybe we're doing quite a bit already, you know, in order to mitigate that risk. But what else could we do? You know, that's the next stage. How could we further reduce that? And then you review and improve it. So depending on how regularly you want to review it, and depends on the task, depends on other factors as well. So say if you have an accident or you have someone go off work sick, you might review that quicker. You know, don't wait until a 12-month period. I always think a minimum quarterly. If you can do that, that is great. Certainly a minimum of once a year. You know, you need to be reviewing all these practices, even if nothing's happened, you know, that would make you raise any concern. I certainly think that once a year you need to be going through those and looking at that. I always prefer quarterly because I think just that continuous improvement takes a long time, and a lot can happen in a year, so I wouldn't always wait there for that long. Okay, so control measures. So this is what we put in place to lower the likelihood or the severity of an event happening. So as a safety professionals, this is what we used day in, day out. It's a very basic tool. Even if you've been on, you know, quite a sort of basic health and safety course, you would have been exposed to this and you probably would have used it. It's the kind of thing you do anyway. So basically, you start at the top of this and you work your way down. which is quite interesting because as soon as we mention control measures and health and safety, people that don't really understand safety or have not been exposed to it and not experienced with it before, they jump straight to the bottom and they go straight for PPE. You know, and it's okay, well, I might get run over by a lorry. Okay, I'll put a hard hat on, or I'll put a high-vis vest on. Well, I'd much rather reduce the risk before that than rely on, you know, someone seeing me in a high-vis vest before they run me over. Or if we've got a forklift truck coming, I'd much rather that forklift didn't go over my toe than it went over my toe and I was relying on a safety boot to protect me. Easy. We can remove that before we get to that stage. That is what you're aiming for. And the PPE is basically, it's only there. So basically, we can't remove the risk throughout this this hierarchy of control, throughout these other control measures. Then you put that in place, and that is what you do. So the first one is elimination. So this is basically swapping something out. So an example of this is, you know, some things just don't need to happen. You know, could we not do it? You know, could you outsource it? Could you buy it in a different way? If you are a manufacturer, you know, could you get components in? Could you eliminate that risk completely from your you know, from your supply chain, from your processes? Is that if it can't be eliminated, can you substitute it? So an example for this is substituting for cleaning in your house. You look at something like bleach. You know, can you substitute that with white vinegar? You know, that's a lot safer. You know, it's not got all the hazard. You've not got all the control mechanisms that you need for bleach. Is that something we could do? Is that acceptable? Is it still going to work effectively? Can we do that? So substitution is your next one. And third one's engineering controls. So this is physically removing the person or the object from the hazard. So an example of this is a barrier. So if you have around a car park, for example, you will often see they're all painted with lines, but a lot of the time they will have a physical steel or concrete barrier that prevents pedestrians coming into contact with their vehicles. So they've looked at that and they've established it's not enough just to have a system in place, or that's not good enough. With line marking, for example, we're going to put a physical barrier. We've engineered and controlled that out. The same way is with guarding. So if you look at something simple like a blender in your kitchen, it'll normally have a guard system on that it can only operate once that the guard is in place and interlocked. So when the lid's clicked on, that is the only time that motor will engage and use that. That's an example of an engineering control that's been factored in order to make that safer. It's physically removed the chance of the person coming into contact with the blades in the blender. The next one, administrative controls. And I'm always surprised, and people are always surprised when we work through this with them, that many of the changes are here in this section. And administrative controls is changing the way in which we work. So this is changing the approach we do. So it can be simple things like providing training so that your people are well clued up, they're well educated, they know what they're doing, they're aware of the risks, they know the safe systems they need to stick to, they know what to do. It could be things like if you're getting deliveries, changing the way in which you work in terms of delivery times. You know, can we get deliveries at low traffic times on the road, much less time of an accident? You know, if we're near to a primary school, for example, let's get the delivery times outside of that. You know, outside of the school drop-off and pick-up times. Simple things like that can make a real big difference. You can also look at things like the size of which you order things. So if you've got a manual handling risk, for example, you're worried that a box is too big, too heavy for someone to handle on their own, and they've got it and they might hurt their back. You know, can we get it in smaller boxes? You know, can we decant some of that out and make that smaller? You know, how can we work in a safer way in order to do that? And then, as I mentioned, the last one is PPE. So, and this is basically, if we can't remove these risks any further down, or we're still unhappy that there is an amount of hazard present there, we can use some PPE in there. So an example of this would be someone using something like an angle grinder. You know, can we eliminate it? No, we've got to do it. Can we substitute it? Not really. Engineering controls, well, there's some guarding on the machine. It's got a safety switch. We're going to do administrative controls. We're going to do it in a safe place. But you know what? we still need some goggles on, because there is still, with everything else that we've done to make that safer, there is still the risk that a particle might become airborne and might go into my eye. So I'm still going to wear some safety goggles. Even though you've done all that, you've reduced it down, your final one is still your PPE. So just to go through those again, these control measures, so basically you start at the top, it's called the hierarchy control, and you work your way down. So it's elimination, substitution, engineering controls, administrative controls, and finally PPE. So we're going to look at an example here just for using this hierarchy of control. So this is something that I'm going to be doing after work tomorrow, which is going on I'm going to go ride my mountain bike. So just to let you know, that is not me in the picture. I wish it was. I'm nowhere near as good or as brave as that. But yeah, I wanted to look at something like this for you. Just so hopefully, yeah, you'll see you can apply it to anything. You know, and the tasks you do are going to be very varied for your different organisations. So it's just give you an idea about what you know, the kind of things you can do. Okay, so identify the hazard. So we're going to look at something specific, like I mentioned. So it's going to be a broken bone from falling from the bike due to misuse of the mountain bike. So if I am riding that bike well, and as it should be, and I'm sticking to the tracks, I'm doing everything right, there should be no need for me to break my bone. You know, that should not happen. But if I misuse it, and maybe I try and do something that is beyond my capability, or I just, you know, I slip, you know, and it just goes, or, you know, something else happens and goes wrong, you know, I could potentially end up with a broken bone. So who's going to be harmed? Well, in this instance, and for this example, it's me, it's the rider. So what are we already doing? Well, I'm an experienced rider, you know, I'm wearing PPE, I'm wearing suitable clothing, I'm wearing a helmet, I'm wearing gloves, give me grip, suitable footwear, that kind of thing. You know, I'm going out, I'm well kitted up, something I've done before, and again. So, and then what could we be doing? So basically, this is then where you work through your hierarchy of controls. So could I not go? Could I eliminate that visit on the, you know, to the bike park on my bike? Could I take that out completely? Well, you know, if I look at it, you know, exercise is non-negotiable for me. I need to exercise. So no, you know, I'm not going to do it. I'm going to go. We still need to do that. We still need exercise. So then you go into substitution. So could I do something different? You know, if exercise is what I need, could I go for a walk instead? Which is still going to give me the exercise that I've said is a non-negotiable that we need to be doing, but it's not going to have the same level of hazard that riding the bike is. You know, is that an option? Could we install a barrier? So here we're looking at an engineering control. So could I install barriers down that side of that track, or cushions or something like that, that will mean that it's going to physically remove me from that hazard? Well, it's a public place, so it's probably not going to be practical. Well, it's definitely not going to be practical. I'm not going to be able to do that. But it's the kind of thing that in another situation, there might have been something like that that could work. You know, for example, if it was, if you were going into water, you know, a life jacket, things like that, you know, having a means of rescue or a means of preventing you from falling in. Could you tie on so you couldn't fall into the water? That kind of thought pattern is what I'm trying to get you into. So then what can we do? Administrative controls. When I said it's always quite surprising how many you get in here. You know, even if you look at this example, you know, there's far more far more points here. So the way in which you do it. So how could I change the way I'm doing this in order to make it safer? Little thing. Warm up first. Make sure I'm ready for it. Go in daylight. Make sure I'm timing that so I'm not getting stuck out in the dark. Because if I get poor vision and I'm stuck out there, you know, there's going to be a lot more chance that I'm going to, you know, end up injured or coming off, not seeing a hazard, that kind of thing. Go for a practice run first. Get used to my bike. Do an easy run first. Get used to it before I'm pushing myself. You know, it's just getting yourself into that mindset. These are all little things I can do to make my time safer. Familiarise riding the track, so I can walk it first. You know, if there's any big drops, any big jumps, maybe I leave my bike, I'll go and walk around it first and have a look. You know, sometimes drivers will do this in vehicles. You know, we always used to, when we used to work as a contractor, if we had deliveries, we weren't sure about it we'd get the driver, just come out and have a look, you know, and see what you think, you know, first. Come and familiarise yourself with the environment, with what you're going to be working in before you come in your vehicle and do it. So other thing I could do, I'd go to quiet time. So if I've got another rider breathing down my neck, pushing me and making me go faster, chances are it's going to increase that likelihood that I'm going to make a mistake and I'm going to come off my bike and something's going to happen to me. So going at a quiet time is one way I could make that safer for me. Buy a new safer bike. So I mean, this as a rider, this would of course be my preference, that I would always want to do that, and any excuse to buy a new bike would always be good, a good excuse. So basically, if I need to do that, it's prepare a business plan for your business owners, or for the management team. So you basically got to lay down financial outlay and what it's going to cost. So in my instance, that would be presenting that to my wife and saying, look, I could get harmed, I need to get this new bike, it's going to cost X £100. Can I get signed off for that? And the answer's going to be no. So move on. But just give you an example, that's the kind of thing you could do. So, and then we come down to the last one, PPE. I've already identified I'm going to be wearing PPE. In terms of a helmet, gloves, suitable clothing, that kind of thing. Could I do that any better? My normal helmet that I run most of the time is just one on the top. Could I wear a full face helmet? That's going to protect my jaw as well. Is that an option? Can I buy one of those? Can I use that? And then you review and improve it. This is the final stage that we looked at. So it's looking at options for when you do this next time, even after you've done that activity. Take a look back at it. See what went right, what went wrong. What could have happened, what could have been done better, what could have made that safer, how could we improve that, and just continually do that through all your processes. Okay, so the next thing we're going to look at is training. So it's a really good tool to improve your safety officing. It's a key part of what we do with our clients all the time. We do training gap analysis, and we prepare plans, and we deliver training ourselves, and it really is really important. It does make a huge difference. As an employer, I know previously, I'm doing this with all my staff, it really raises the levels of professionalism, their outlook towards work after doing it. When I ran a contracting company, it was definitely like when the guys went training, doing predominantly safety training, but even when they did their tickets for their forklifts and diggers and all that kind of stuff. So in the next few weeks when they came back, so much more professional, positive, just looking at things in a completely different way. And it really does work. So so we'll look through the process really. So first of all, you identify the gap. So this is something we do. So basically you take the person, you look at their skills, competencies, what training they've already got, the task that you're looking them to do, and the role you're looking for them to complete, and you look at where they where they need a bit more training or a bit more encouragement. Sometimes this will come back from your performance reviews as well. We often find sometimes we sit on these as well. People come in and they'll ask them about what they feel they're doing well on and what they're delivering well on and what they need to help with, and you sometimes get it through them. And it's normally, as long as they are the right type of person for the job and the right personality and the right basic skill set, you can normally train them and develop them in order to do that effectively. And it's all about making them, when we go back to the whole thing with stress, anxiety, depression, that kind of thing, if you feel out of your depth doing something, it's a very, very, very low place to be. And if you don't feel you can do a job right, and you don't have the skills and competencies to do that, it's a really stressful place to be. So this is where that gap analysis really comes in. So the next one is allocate resource. So again, we're going back to this. It's one of the key things as you, as the main tool, as the business leader or owner. It's actually putting this to it. So you have to put time towards this. It should be your health and safety training should be able to be completed in your normal working time, or if not, should be compensated somewhere else with it. You have to make time to do this. You have to allocate the funds towards it. It's just something you have to do. It's crucially important. There are some sources of funding available. So, for example, if you probably already know this, if you work in construction, but like the Construction Industry Training Board, you pay your levy, but you can claim back, for time for your staff to go out and for the cost of the course as well. So even if you're in other sectors as well, there are often funding available for training and development, which I would, I'd encourage you to explore. So encourage sharing. So one thing that's a really good tool for this is once someone's gone on a course, set up a little session with them afterwards with the rest of the team or the rest of the company and get them to share what they've learned on that course and that training with you. And one, it really helps them in terms of just, sharing that information. It's an empowering thing, isn't it? It's like I've gone out, I've been selected by the company to go on this training, and now I've been asked to come back and share this. Now I'm presenting this to my team, to the other people in the organisation, what I've learned. And it's really good. And they employ the employees, even though they've not been on that course, they'll pick things up from it as well. I'm not saying that replaces sending them on training they need to go on as well, but it's all part of it. It's all part of that information sharing and best practices and ideas, and it builds this culture where everyone's learning and everyone's continuously improving, and everyone's working towards a safer environment. The next one, refresh regularly. So as we forget, and you can learn something, you might forget it. The importance of it goes out of your mind pretty quickly. So certainly for things like that high hazard, you need to do that refresher training pretty regularly. And even on so it's like your lone working, people get out of, the best practices quick. So if you've got everyone working at home, for example, and you might do a meeting like, look, you've got to get out and you've got to get some daylight and some vitamin D and some exercise every day. Make sure you get a 15-20 minute walk in on your lunch break or whatever. People are like, yeah, really important. I'll do it for the first week. And then after that, I'm answering an email, I'm doing this and I'm doing something else. You just need to keep getting it back into them. And we all do it. We don't learn things 20 years ago and still practice it now. And that constant refreshing of training is really important. And you can build this into your continuous development plan for your people if that's appropriate for you. So for example, we have to, as safety professionals, we have a minimum 30 hours a year we have to do of continuous professional development. And it's good because it just keeps your mind in it and keeps it all fresh in your mind and keeps you learning new things. It keeps you up to date. It's a great thing. So, and the last one is to use training as a KPI. So for small businesses, your KPI, key performance indicator, I should say. I always assume people know these things. They don't always know. So yeah, KPI is key performance indicator. So you can use these, you probably use these in your business anyway. You may be looking at gross cash margin or turnover, that kind of thing. These key financial things or output that you determine the success of your business on. We do the same in safety. So we have KPIs that run on that. And for small businesses, it's often quite hard to get a lot of data. So big organisations often monitor it better. They might have access to more sort of incidents and hazard identification and accidents. The small businesses, I hope you don't. You shouldn't have masses of data relating to that. I certainly hope you don't. Otherwise, things are going a bit wrong. So using something like training as a KPI can be great. So you can look periodically and say, from this year to last year, how much training did we complete? How many hours did each employee do? And it's a really good indicator because there's certainly a direct link between getting things right and the amount of training you do. And I can guarantee you that. And if you were putting the time and effort in, you're sending people on the right courses that are appropriate to them, you're going to see a benefit. You're going to see that come through. So that is one really good thing. It's for small businesses and for large businesses as well, but particularly small businesses because you don't have that large amount of data about is used the amount of training delivered in a period as a KPI. Okay, so use software. So a little bit like the way that we have do this in business all the time with something like accounting. A lot of us rely on software now. We've imported this to save us time and energy and hassle, and it's great. Use something like Xero, links up to your bank. It's automated. It does most of the work for you. We can use things like Dex now, where you take a photo of a receipt and it automatically, breaks it down, analyzes it, and allocates it. It's brilliant. It's saved us time and effort, and it means that we can focus on doing our main role and our job, or saves us time and accountancy fees. And it's been brilliant to it. So you have the same with software for health and safety as well. So there's loads out there, and you can use it just to keep all your data in one place. Make your risk assessments available. You can keep training records. You can allocate tasks for people to do. So, for example, if you're a health and safety manager and you've got people working, you can allocate a task to one of your subordinates to go check all of the ladders once a week or something like that. That kind of thing. Check all the walkways are clear. Check all the fire doors are intact. You can allocate those to people. It's really good. They don't all cost a fortune. Some of them are very expensive. Some of them are pretty reasonable. Some of them are free. So, for example, Safety Culture, which is one of the ones you'll see the logos there, for between, I think it's up to 10 users, it is free. So it's a great tool to use. You can use that if you're a small business and you just want to use that for a few checks and tests. By all means, do it. I would say if you are not a qualified safety person, you are going to need some guidance and some help doing this, just to make sure that it is suitable and appropriate. Quite a few of them use quite sort of standard templates, which might be right for one business, they might not be right for yours, and it is really just worth getting a bit of help and a bit of assistance doing that. Some of the providers will do this for you, so some of them provide an amount of onboarding included in the price that then they will get you set up and make sure it's appropriate. Some you have to pay for. It's also worth looking at if you've got just going back to linking with HR, if you've got a HR system, there are a number of those that have a safety add-on as well, that then you can add that onto your package and then you can use that as well. So yeah, but really just in terms of use that's available. We live in a contemporary period where we've got this technology available. Use it. Don't be relying on doing everything on paper and writing everything down. It just makes everything so time consuming that you're going to end up not doing it, basically. So definitely explore that. Again, if you'd like any more information, you can book a call with me. I can certainly point you in the right direction of what I could recommend to you. Okay, so engage with staff. So I mentioned this a couple of times. It's a really big contemporary thing with health and safety nowadays, is engaging with your staff effectively. So as we mentioned, you have a legal requirement to consult with your staff on health and safety issues and engage with them. But the benefit you get from it is so much bigger than just ticking that compliance box. You really get a lot with it. When you really get down to the crux of it, and you make people feel valued and that kind of thing, you really do get some good feedback, and it's really motivating for your staff. So we always start off with, I don't know, talking about something. If you're starting off a conversation with your staff, don't start off talking about, well, this is a legal thing I've got to do. I've got to do this. I want to tick this box, and this is something that we've got to do. If ever I'm doing a meeting like this with someone, I start off and I'm like, look, this is all about you guys. You're at the centre of this for us, and that is why we are talking to you about this, because we want to make your working environment safe, and we want you to be well, and we want you to be happy, and we want you to be working well, and that is what we are aiming towards. So there's a number of ways that you can do this. You can do this for your formal meeting. So as I mentioned earlier, the company that we work with now have a monthly meeting with everyone involved. Stick it on the agenda. Just have it that it's something you talk about. And one thing I would say is, because some people have a habit of doing this, which is don't stick it right at the end, because sometimes people, not sometimes, quite often, that is where it is. But all right, I'll put that about last topic, health and safety. Anyone got any issues, anything to say? Quiet room. Everyone's already checked out of that meeting already. Don't make it the last thing that you talk about, because everyone is just waiting to leave at that point. That is not going to be the time that they're going to come forward, raise a question, raise a concern, talk to you about it. I'm not saying you should start off with it, but certainly put it up the priority list slightly, and you'll find you might get a bit more feedback that way. Informal conversations are great. So a lot of people do not like putting their hand up. Big groups meeting can be an intimidating environment for a lot of people. You might get more out of them, talking to them on a one-to-one, having a little chat with them while they're doing a job, whatever. If you're doing a risk assessment, go out with them. Go do that role with them, to have a chat with them along the way, talk to them about it, and you'll probably find you'll get a lot more honest feedback that way. WhatsApp group. So some companies have a dedicated health and safety group in there. WhatsApp groups, great. People can just chat away in there, put ideas in, identify hazards. They can put photos in. You can use before and afters. Put one in of before the hazard was attended to, afterwards, medial, pointing things out. It's great. You can have that conversation in there. It can be a real good tool. Walk around, so basically just having a walk around your place of your place of work, the building, having a look around, walking around, talking to people, seeing what you see. If you're just stuck in your office all the time and you're not getting out and about there and really seeing what's going on, you're probably not going to have a great idea about what is going on really, and what you could be seeing. So if you look at, say, like a construction site, for example, you'll see the good site managers will often have regular walks around the site just to see what is actually being done, not what people are, said they, we're going to do or should be doing. So that is really good. You could have an email account dedicated for safety issues as well, which is quite good, that people just know that if there is an issue with health and safety, anything they've got a concern about, they just know it's just one email address they need to send it to. Again, you can do it with the P person as well, just so they know who is their dedicated person they need to talk to. And it's really good just to get that conversation going. As I said before, when you have someone's been on training, get them back in, get them to share that learning. It's all this process, and it all works, and it all can go together really well. And it's something you should really, really put some time and effort into, because you really will get some benefit from it. Okay, so we're going to look at a couple of ways of how to improve staff engagement. So if your organisation's big enough and it's appropriate, create a committee, get a group of people together that are dedicated and keen and energetic about improving safety throughout the business. And these become like your champions for it, really, and they can work together, share ideas, get ideas from lower down in the organisation. They can bring them to you then, bring proposals and that kind of thing forward. It's really good. Involve staff in risk assessments. So I do this at all levels within your business. You might not be able to do them all yourself, maybe get their line managers to do them, but certainly next time you review your risk assessment, involve that person that is doing it. Go through it with them. So, approach them, look, we're reviewing this risk assessment, something you do all the time. This is what we've got in place, as you know, because you've been working towards this already. How does it work? Show me that job you're doing, and I'm going to compare it to this, and you tell me where you think it falls down, or where it could be improved, or how we can make it safer, how we could do it, and do it with them. That no one really likes, not saying no, most people don't like being dictated to and being told, look, this is the way you have to do it, that's that. Especially if you've been doing a job for a long time, you might have been working on a shop floor for 20 years or something like that. Someone in the office comes down like, this is risk assessment, this is what you've got to do. Don't care about how your experience, don't care what you're saying, this is what you've got to do. They're probably not going to do it. If you involve them and say, look, you've got loads of experience, you're the person doing this, I need your input in order to get this right for you and get this right for other people and make this safe. Much more likely to be implementing that. And again, it's the sharing of information. So the thing is, with getting things written down and doing diagrams and drawings and sketches and all this kind of stuff that can be recorded, makes it a lot easier for sharing that information in the future. So if you're doing refresher training, or you've got new members of staff come on that need inducting, having things written down, say systems of work with clear explanations, is going to make that a lot easier and a lot more valuable. Okay, so how to improve staff levels of engagement. So there's some really simple things, really. The first one, I think, not all of us are great at it. Listen. Just listen to your staff, listen to their concerns and take it on board. And I don't mean just ask them what they think, but don't really, take it on, or don't listen, or you're just like sort of asking them for the sake of it because you should be engaging with your staff. Actively listen and see why they have these concerns, why they think things might be improved, and get that background of it. And that's a really key point towards that. And the next thing, if someone comes with you in a concern or an idea, make sure you implement something about it. Again, no one likes just being thought that, nothing ever happens when they talk to someone. You hear it loads. where people are like, well, why did you stop? Why don't you say something about that? Well, the last 20 times I've said something, no one's done anything. So why should I bother now? And you hear that all the time in workplaces. You'll get to a point, if you don't start implementing the suggestions and the ideas they've come up with, they'll stop coming towards you with them. And then you're failing on this engagement area. Monitor, assess. So put something into process, check on it. Is it working? Is it making things better? Is it making things safer? Are people doing it? How can we relook at that? Does it need adjusting? How can we tweak it? If it's not worked, maybe take it back out. And if it's made things worse, or for whatever reason it just hasn't worked out, you can always unimplement that and go back to your original process. But at least you've shown you tried it, and you've got, because you monitored it and assessed it, you've got some data and some credibility for why you think that didn't work and you took it out. And then review and improve. Again, just coming back to this concept and this idea of continual reviewing, constantly improving. So we're always looking at what we've put in, look at if it worked, can we improve it, can we review it, how can we make that better? And it becomes this cyclical process that you go back through. And you go back through to listen, implement, monitor, assess, review. And it really does work. And if you get something, 1% better each time, over a long period, it's loads better, significantly better. Okay, so we're going to have a look at this, how this can be a superpower. So in my previous business, so I didn't actually touch on it at the beginning, I probably should have mentioned that. So I used to run a construction company, did that for 12 years. And one thing that I really learned along the process and really implemented was that health and safety could separate us from our competitors. And, you see people do this in construction all the time. If people have got CHAS accreditation or construction online, safe contractor, all this kind of thing, they really advertise it and they really push it and use it as something that can win them work. If you don't work in construction or manufacturing, you can use this as a tool to help you develop your business. So in my previous business with a contractor, what we did was we identified areas of working where we weren't competing on price. We were competing on things like safety. So for example, we used to do a lot of work in live school sites, live hospitals, RAF bases, army bases, some prison sites as well. And you really just moved away from competing on price and compromising on margin all the time to you're selling on your safety provision. So you're still giving a really good product, but you're doing it in such a safe way, and that was really what separated us. And you can do the same in any business really, because the principles are the same no matter what you're doing. And even if you've got everyone working at home, if you're doing good safety practice and you're going to if you're going to companies that you want to apply to work for, and you're like, this is how we look after our staff, and this is the procedure we've got in place, and we talk about and be vocal about it, it gives you so much credibility. And if we look at something like B Corp, for example, and the popularity that's got, now people are incorporating that into their supply chains. They use that sustainability and, system management, that kind of thing. It's something people sell on now, and it's nothing to do with the actual product they're doing. It's just like selling themselves as a responsible company, basically. And you can certainly do the same with safety. So this is one thing, like I say, I've used it as a superpower. It's one thing to attract the work. So there's two sides to it. So one, you can use it to attract the best work, get the best client. So you create this organisation that everyone wants to work with. They all want you to do their work. And then internally, you put that time and focus. It becomes a place where everyone wants to work and no one wants to leave, and you can attract the best people and you retain them and you keep them, and they want to stay with you because they feel valued and they feel like part of the business and they feel like part of the process, and they feel safe and they're happy and they've got low stress levels, and you've got it right, and they're working with it. So I've used this diagram. I think it's true of doing any improvement within your business, if I'm honest. And safety is certainly one of them. So I think, like anything else, that when you focus on improving one area, it has this ripple effect throughout your business. So you might do an improvement in safety and improve everyone's training with that. It makes them more professional, it makes them more clued up, it makes them thinking about things in a different way. I think the same could be said with something like quality. If you focused on product quality, for example, I think it just say, it filters through your business. So I think any kind of improvement can really help you out and really change your business. Okay, and that brings us to the end of our presentation and this webinar today. So we will share my contact details. If anyone would like to have any little information on anything in particular, any questions, queries, please feel free to do it. You can go on the Limelite website as well, and the details of the health and safety services that we offer are on there. I give a free 30-minute conversation with anyone, initial chat. So if you just wanted to have a little bit of a run through to see if you need some help or you don't, or any little guidance, if you can do it in that half an hour, then please feel free to contact me. So I'd like to thank you for your time. I hope you found it useful, and hopefully I will speak to you guys again soon. All right, thank you.